everybody. My name is Christina Ducharme, and I am going to introduce the class of the newly diagnosed diabetic teaching class for nursing graduates that have an interest in providing care of the patient who's been recently diagnosed with diabetes type 2. Specifically, I would like to focus on the elder adults. New diabetics do have access to classes that enhance their knowledge and understanding of this disease. This class was developed to guide new nurses to provide specific care and concerns of the newly diagnosed diabetic during their nursing care. The course will cover a general understanding of type 2 diabetes and how it's diagnosed and managed. The course will also cover what to expect when the diabetic is recently diagnosed with this diagnosis and the signs and symptoms of diabetes. Other topics included will be complications and infection prevention, specifically towards the elderly. The course will be wrapped up with ways to reduce risk factors of diabetes and minimizing complications. There are many different areas of teaching in the diabetic world that can be overwhelming or too much information to receive all at once. This class was designed to help new nurses with the basic teaching information and instructions for new diabetics to receive help and prevent complications, and help to make them aware to receive proper medical management that they will need. The audience for this class is focused on newly graduate nurses. These students will be giving care to new diabetic diagnosed patients, and I believe that this is a good fit with this class, as it will go over the basics understandings and help with implementing the basic needs of a newly diagnosed diabetic. This class is going to be an online class, and we're going to use a synchronous format, meaning that it's going to happen at the same time. The course was developed to be Monday through Friday, 6 to 8, with a 15-minute break. This class will be online because of the University of Phoenix rules, as I am an out-of-state student. The design model that will be used to help supplement this class is the model of ADDIE. ADDIE is a syncronym that means analyze, to identify the learning problems, to design the content that will be determined for the class, develop the content and the learning material that will be produced for the class, implement learning the materials produced, and we will be evaluating the class as well with feedback and revisions if necessary. The method used for this class. The instructional method is going to be of Bloom's taxonomy. Bloom's is one of the most models used in any type of learning structure. Bloom's technology has 6 pieces of information that goes along with it. It uses knowledge, comprehension, application, analysis, synthesis, and evaluation. The knowledge is the recall that the student has prior to coming to the class. The comprehension is the learning level of the student. Application, the use of methods, theories, new situations. To analyze, you break down all the information. Synthesis will be using some creative thinking, and then we'll evaluate the different values, ideas, and whatnot. Some of the topics and objectives were outlined for you already. But to just go over them again, an overview of this course, the certain topics that we'll be covering are the signs and symptoms of diabetes, how to accurately obtain a blood sugar, and how to accurately test a blood sugar. We will be going over insulin instruction, how to inject, and the use of long-term and short-term insulins. We'll also be going over the importance of a blood test called a hemoglobin A1C. We will go over complications of diabetes and infection prevention, specifically in the elderly population. And to wrap it up, we will talk about reducing risk factors and ways to minimize these complications. To make these topics measurable, we've come up with some terminal objectives. The terminal objectives for this class is to understand what diabetes type 2 is, and knowing the area of a hyperglycemic and the role of insulin or insulin resistance, and what the role of the pancreas does in diabetes. Other objectives is to know 5 signs and symptoms related to diabetes. We will hopefully be accurately performing blood sugar finger sticks with proper technique and using a glucometer machine. You need to know 2 long-term and short-term insulins and know peak times as well. We should all know what a hemoglobin A1C test is and know the normal range and a range that would be considered out of control. Need to name 4 complications of diabetes type 2 and also know the risk factors that enhance chances for the development of diabetes. The objectives that were picked for this particular class came from research. It also came from an idea from my mentor, who I'd like to thank very much. Her name is Helen Jenkins, who has helped provide input on this particular area of subject. She has helped me in many ways, as she is a diabetes education instructor, and she helped me coordinate this class. We chose our objectives after going to diabetic seminars and doing some one-on-one interviews with diabetic patients to try to figure out what their specific needs were. We also thought that the objectives that we picked went along nicely with the Bloom's taxonomy. All the objectives align with having basic knowledge, comprehension. We'll be using application, as we will be trying to perform proper blood glucose testing. We'll also use analysis, use some creative thinking or some synthesis, and then again the class will be evaluated. So, as this class is going to be online, we wanted to pick a particular vision. As we were looking through visions, we came across the vision from the ANA, which we would like to use for this class. The vision of the ANA is one to be recognized as the voice of registered nurses in Massachusetts through advocacy, education, leadership, and practices. The final objectives of the newly diagnosed diabetic course include an understanding of diabetes, signs and symptoms, blood sugar A1C monitoring, complications, and risk factors. These objectives follow the mission and value statements and increase nursing knowledge about diabetes. This enhances opportunities for leadership. In discussing industry standards are resources to use when planning a curriculum. It is important to use the guidance of teaching in a nursing profession. Educational industry standards seek quality, innovation, and accountability, and provide quality standards that adhere with compliance, implementation, and guidance of knowledge through practice, and it helps the process of education and ethical matters that provide core competencies. The industry standards of the ANA include guidelines, standards, and frameworks to produce an outcome of an expected learning. The proposed goals of the terminal include the 5 steps needed in nursing with the use of Bloom's taxonomy, including assessment, instruction, diagnosis, planning, implementation, and evaluation. Here is a quick look at the textbook that we will be using for this course. It was chosen as this is a basic course to go through diabetic management of the elderly. This was a great resource and can be used for patients as well. So this is why this specific textbook was chosen. You will need to have this textbook before coming to the class, and we will be using it and going through specific chapters in this book. I do apologize that I couldn't find a better picture of the book, but the book is entitled Type 2 Diabetes Basics. It's Patient Book 4th edition, and it's published in the year 2012. It's a great resource because this book was published by the International Diabetes Center, which is a great resource for diabetics. Through this class, we will also be using other materials. I hope to produce a video by the Mayo Clinic, which is actually another great resource for diabetics. The video will be retrieved from multimedia from the Diabetic Mayo Clinic, and I will also be using some additional handouts that were given to me by my mentor, Helen Jenkins, and we're hoping to provide glucometers for glucometer testing. Learning activities for this class is as followed. We chose readings, some group assignments, lecture, video, and using some hands-on teaching by using a glucometer machine. I have also made up a class syllabus that you can go through so you will know the readings ahead of time. It's divided into 2 weeks. As I said, this class will be 2 weeks long, 6 to 8 with a 15-minute break, and I will be providing the syllabus online so everybody can view it before the class starts. In teaching this class, I do have some responsibilities. In my responsibilities, I would love to encourage the students to learn. I want to follow the standards and respect students. I'm hoping that my objectives are clear and that people understand the requirements of the class. I want everyone to achieve the lesson learned. We will be evaluating. Students' performances will be evaluated in this class. I can try to help with arrangements of alternatives if somebody can't make a particular class. My responsibility is also to make sure that the objectives are clear. I would like it presented in an appropriate content, and I would love to create opportunities for open discussions. In choosing what I needed to do for this class, I used the SMART objectives. SMART objectives is another acronym. SMART is specific, measurable, achievable, relevant, and time-bound. The responsibilities of you, the student, is to understand the course requirements and expectations that are provided in the syllabus. I would love for everyone to adhere to the student code conduct. Do not use any abusive language. You are responsible for the costs of the book or the material, which was chosen. It's not very expensive at all. Complete your work in a timely manner. Do it by the deadline. Seek assistance if you need it. And if there's any disabilities of anyone, if you would kindly let me know before the class begins, I will try to accommodate you. The methods of teaching are outlined in the course syllabus. We will be using lectures. We will also be using some group discussions and some hands-on type of learning with the glucometer testing. Hopefully the different styles will help coordinate everyone in different learning structures and everybody will have the ability to learn. I'm hoping that this class has some positive outcomes and everyone gets a general understanding on how to assist the newly diabetic patient with their needs. Thank you. Have a great day. Just a quick note to Professor Moore. My syllabus will be included through the clinical aspect of this class. Also, I will be including my references separately from this video. Thank you. This was very interesting.